So let's recap this one. You're dispatched to a bus stop for a patron who was unable to get on the bus. Driver states always catches the 8:05 to get to work, but today she is too weak to climb the steps. So we see a change in normal habitus here, normal ability. So the person is unable to do what they normally do. So that should be a concern to us. And the other concern is the fact that the patient didn't call us. Somebody else who knows this person is witnessed. That's of concern. So let's look at our initial set of vital signs here. Get that pressure going. See what do we got. 100/54, tacking away at 118, SATs 95 with a low pleth. So we got some constrictions, either really cold out, the person's noradrenaline is constricting their periphery to shunt blood to the core. Little tachypnic, and end tidal is down. Map is 69. So we're above 65. We're doing okay there. Pressures, meh. I don't know what the normal pressure is for them. This could be a very skinny individual, very in shape, and normal for them is 88/60. And this could be hypertension for them. So I'm not sure about that. But based on the end tidal, I'm going to go with that's not the case. So we have that lower than normal end tidal, 35/45. They are tachypnic and they are tachycardic. So a person who's struggling to get up on the bus doesn't sound like they just ran a marathon and have a sustained elevated heart rate from that 6 mile an hour mile that they ran 4 times over. So let's grab a EKG here. So what do we see? We see tachycardia, good axis, no RV strain, no S1Q3, T3. P waves look symmetric, so we don't see any atrial changes. Nothing really jumping out here, except for potentially looks like a tachycardic EKG. Amplitude, some V1, V5 is definitely less than 35 millimeters. So I don't see any ventricular enlargement. So does the 12 lead look at the full circumference of the heart? Yeah, that's no, right? B, because it looks at the right quarter, so the inferior leads, looks at the anterior aspect, some of the lateral aspects. So it looks at about maybe a little less than 2/3. We need to do a posterior and a right-sided to get closer to the full circumference or circumferential picture. If you look at the new LifePak 35, they have actually a built-in 15 lead bundle. So you can add a third bundle to your EKG leads and you can actually do a 15 lead, which is pretty phenomenal. I don't think this is an occlusive coronary issue. No, we didn't see any ST changes that would be indicative of that. And we didn't see anything that would be reciprocal to the posterior in the V1 through V4. So V1 through V4 were not ST depressed, which would get us concerned with posterior elevation. So reciprocal change that. Now, we did a 12 lead. We should do a 15 lead, right? If we're going to invest the time and energy to do a 12, we should get a bigger picture of the heart. So what's our primary differential? OMI. So is it an occlusive myocardial infarction? The new term for AMI, which would be acute myocardial infarction. So do we have a blockage? Maybe, could be end-STEMI. Whatever this is affecting her perfusion and her gait. So could it be a stroke? Could be. Didn't do a stroke assessment. We should do a BFAST. Maybe it's just the gait. Maybe she has a cerebellar infarct, and that only issue they're seeing is her, wondrous gait and inability to maintain good forward motion. That's why she can't get on the bus. Is it sepsis? Could be. She's tachycardic, tachypnic, lower than normal end tidal, and pressure's a little on the lower end. So maybe she has sepsis. And you're seeing the gross perfusion effects of that, and the acidosis starting to kick in. Or D, other, yeah, what could the comment be, right? Could be a bunch of stuff. Could be a thyroid issue. Could be complications from a new change to a medication. Could be weight gain, weight loss that she's had and has not had her medications changed. So it could be a number of things. But in the picture we see here, don't think it's A, B, C, and D. Definitely options that we could work with. So we hope that helped. As always, if you have any questions, hit us up at info@lifelineemstraining.com, and we hope you have a great day.